People think that HIV and AIDS is both the same. They use it interchangeably. Can you just brief a little bit?
HIV infection and AIDS are two totally different things.
Kissing a HIV person would not transmit the disease.
No.
Sexual behavior with the HIV person, whether it would transmit the disease in a single sexual act. Namaste everyone. Myself Dr. Abhid B. Shetty, CEO of Janavaidya, and we have eminent person here, Dr. Srikala Acharya. She is a public health expert, MD in community medicine, and she has also experience of being an additional project director in Mumbai District AIDS Control Society. So she has a pretty good experience in that. And today's topic is a very interesting topic. It's about AIDS. So we'll hear from the expert itself. So just be very patient throughout the video. We have many FAQs coming up. So ma'am, let us start.
Yes.
Okay, ma'am, can you just briefly tell us what is the state of HIV in India, and what is the a few numbers about what is the trend and prevalence?
Yeah. So HIV, that is human immunodeficiency virus, which is the infection, and it leads to the disease which is also known as AIDS, acquired immunodeficiency syndrome.
Yes.
Now we need to understand that this HIV infection per se is a majority of the times it is sexually transmitted infection. In India, out of 100 HIV infected people, more than 90 people have got it through their behavior, unsafe sexual behavior. When it comes to the numbers, India is a low prevalence country for HIV disease. 2 people out of every 1,000 would have this infection. And among these people, as I mentioned earlier, majority, 90%, are through sexual route of transmission. About 5% would have received it from their mothers, because mothers, when they are infected and are pregnant, there are chances that the baby could get the infection when the baby is growing inside the mother's womb, or during delivery, or through breast milk. In some parts of our country, there is a lot of youth who are into injecting drug use. And when they are sharing the needles, the injection equipment amongst each other, there are chances that if one of them is infected, it could also be transmitted to others in the group.
Yes.
Because the virus is present in the genital secretions, that is the sexual fluids, in a man, infected man, in his semen, in woman, in her vaginal secretions. It is present in the blood. Yes. So only when there is exchange occurs between the two partners, the HIV virus can get transmitted.
Yes. Ma'am, there is also one misconception. People think that HIV and AIDS is both the same. They use it interchangeably. Can you just brief a little bit more about what exactly is HIV and what exactly is AIDS for the general public?
So HIV is the virus, is the infection. The virus, when it enters inside the body through any of these 4 routes, it lodges or it grows inside our white blood cells. These white blood cells are, you can call it as, these are our armies, which protect our body from the various organisms which are from the external environment. So it enters into these white blood cells, it uses their material to multiply, kills them, and slowly our immunity reduces. And it takes 5 to 8 years for this infection to lodge and to spread throughout the body and to have an impact on our white blood cells. So only when the white blood cells, which are generally around 800 to 1000 per ml of blood, these specific white blood cells, when they reduce to less than 200, less than 50, we have various other opportunistic infections.
Opportunistic infections
inside our body. Opportunistic infections means the normal flu virus, we get the flu within 2-3 days, we are back to our normal life. But in this person, the flu virus can develop into a pneumonia, because there is no inherent immunity of this person to take care of these other infections. So the organisms which take advantage or take this opportunity of lowered immunity of this person and develop into multiple symptoms, we call it as a AIDS stage. That is a syndrome of various symptoms. So the person may have TB, may have pneumonia, could have fungal infections. So there could be multiple infections various symptoms related to that organism and infection,
Yes.
and these do not necessarily recover even
Yes.
with the medicines.
Yes.
So that is when we call it as the stage of AIDS.
Yes.
But HIV infection and AIDS are two totally different things.
Yes, got it, ma'am. Ma'am, there's one more question I wanted to ask you. There are a lot of misconceptions about the spread of AIDS, HIV, basically the virus. And what are the actual modes of transmission? What are the misconceptions?
Yeah. So HIV virus, as I mentioned, is present only in the secretions of blood
Yes.
and the genital secretions or the sexual secretions. Only when these exchange occurs between the person who is infected and the one who is non-infected, the transmission would occur. It is not present in our tears. It is not present in the saliva of the infected person.
Okay.
It is not present in the urine or the stools. So the infection cannot get transmitted by sharing the food, by sharing clothes, by staying in the same house,
Yes.
or studying in the same school, or being friends with each other,
Yes.
or using public toilet, or going for swimming. So none of these routine daily behaviors would lead to infection. It is not present in our secretions, respiratory secretions.
Yes.
So it doesn't get transmitted because coughing, sneezing. So people need to be very confident that just because you know a person who is HIV infected and you are associated with him doesn't mean that you will also get infected.
I have one more question regarding this, ma'am. So, kissing a HIV person would not transmit the disease.
No.
Yes. And in fact, the sexual behavior with the HIV person, it would transmit the disease. But whether it would transmit the disease in a single sexual act?
It is said that it doesn't, the chances of transmission are very less. But at the same time, if the person does not use protection, like condom, or if it happens in under the influence of alcohol or drugs, wherein the person doesn't know, doesn't recollect later on
Yes.
whether he had worn any protection or not, used any protection or not. So there are chances, and it is not just one encounter in such individuals. It becomes an habit.
Yes.
And this behavior, once it sets in, it doesn't get limited to only one. And the behavior per se, maybe first time the person may miss getting infected. But the virus doesn't always take your permission to enter the body.
Yes.
So it is better that the person does or has the right information about how to use protection and uses it consistently, correctly during each of such act.
Yes, ma'am. So, ma'am, currently in India, what are the treatment options available for those people infected with HIV, and how effective is this treatment?
Yeah. So in India, we have free treatment, what we call it as antiretroviral treatment. One thing that we need to understand is that for HIV infected person, the person needs to take the treatment lifelong.
Yes.
Because these viruses, as I said, these are part of our system, and the drugs that we take, we call it as antiretroviral treatment. Retrovirus is also another name for HIV virus.
Yes.
So these medicines, it comes now in a single pill, and the single pill needs to be taken on a daily basis at the same time for entire life, which will kill the viruses and will keep it under control. But if the person is irregular, if the person does not take it properly, there are chances that the virus gets used to the medicine and starts multiplying, develops resistance to the medicines.
Yes.
These medicines are available free of cost in all government hospitals in centers called as ART center, antiretroviral
Is
treatment
it available
center.
in the PHC, ma'am?
It is not available in the PHC, but what is done by Government of India under the National AIDS Control Program is that most of the civil hospitals, we have ART centers. Many a times the patients may find it difficult to reach to the civil hospital for that, or the Sadar hospital in that district.
Yes.
So the patients, once they are stable on their medicines, once they are started, generally first month they would have some side effects with the medicines. And once they once it is ruled out that they don't have any other infections which needs treatment, like it is very common to also have tuberculosis with HIV. So you need to start treatment for tuberculosis also.
Okay.
So once the person is stable with these medicines, we do allow these medicines to be available from the nearest centers.
Yes.
We call it as link ART centers. So these could be at the taluk hospitals, these could be at the PHCs. So depending upon within that state how the medicines are, the supply is distributed in the periphery.
These are all provided as tablets, no injectable medicines.
No, these are available
Any
as
side
tablets.
effects of these medicines, ma'am?
95% of the times these tablets, the current available single pill is tolerated without much of side effects. Very first few days the person may get some nausea symptoms, which are because it is the active interaction that happens between the medicines which is trying to kill the organisms, the viruses inside the body. So the first few days the person may get some side effects.
Okay. Ma'am, which is the most affected population with HIV infection, and what is the problem they are facing to access basic healthcare for HIV treatment?
We have in India around 2.36 lakh people who are affected with HIV.
2.36 lakh people.
Yes, and of these 60% are men.
Yes.
We also have around 7% children. These children who have got the infection from their mothers when they were in their womb. These are now grown up also, because now we, even for pregnant women, we start the treatment as soon as they are diagnosed, so that the transmission to the baby can be eliminated.
It will be completely eliminated?
Yes, yes. And that is also one of the target to eliminate the congenital HIV infection and syphilis infection. So we have people in the reproductive age group.
Yes.
That is, once they attain puberty, they become sexually active. So that is the age group. In certain states, we have youth who are addicts, injecting drug users, who are also one of the risk group to get the HIV infection. So needle stick injury becomes the source of infection there. So basically it is the lifestyle, the behaviors, and it is up to us as a choice. What is it that we choose to keep ourselves safe from HIV infection, that determines whether we are at risk. The other group is, few decades back, it was common among the individuals, the high risk groups of sex workers, men who have sex with men, transgenders. And from there, the infection used to spread to their clients.
Yes.
So most of the times, these clients used to be the migrants into the city, or the truckers who are plying on the highways, who could be having unsafe behavior with such individuals. So these are the bridge population, as we call it. And from there, it goes to their families, that is their spouses, their children. So that is how the infection spreads in low prevalence countries like India and other Southeast Asian countries.
Okay. So what is the challenges that India is facing to control this HIV epidemic, and how can we overcome this?
Yeah. So right now we have something called as 95-95-95 as the target to be achieved. What it means is that if there are 100 infected individuals in any community, 95% of the people should know that they are infected.
Okay.
The second 95 means those who are infected should be 95% of them should be on treatment, antiretroviral treatment. And the third 95 means amongst those who are on antiretroviral treatment, 95% should be virally suppressed. So in case of India, the challenges are in diagnosing the first 95. Because as I told you earlier, for the 5 to 8 years after infection, the person may not have any symptoms, would not have any complaints related to the infection. So would not go to any health facility for getting himself or herself tested.
Yes.
And without their knowledge, the infection could also pass on within their families, to their spouses, to their children, because they have not tested. So, or their sexual partners. So, how do we get people who are at risk, get themselves tested? How do we normalize testing for HIV? Just like how we do the testing for sugars, for our blood pressures. So, if someone who is sexually active and is at risk of getting HIV infection should get themselves screened voluntarily for HIV, which will help in early diagnosis and prevention of infection to others.
Usually people are very afraid to do HIV test, and even when we prescribe HIV test, they usually
They said
never
why.
turn up. Yes.
And the second thing is they also have very low risk perception. They feel that nothing will happen to me. They don't relate that single act or that behavior that I may be having the infection or I may be infected. They don't look at it that way.
Yes.
Because they don't have any symptoms.
Yes. Ma'am, is there any case of completely cure of HIV?
There are few cases reported in the Western world, which is related to the specific procedure under research that they had done it. We also have injections, I mean the treatment available as injections in few, again it is in the advanced stage of research, and it has been shown to have good results of viral suppression. Because for a person who doesn't have any symptoms to remember to take the medicines daily and to continue to do it
Yes.
is also sometimes challenges.
Yes. And this is the final question I just have to ask you. This is for the people who are living with HIV. What are the current resources that are available for them, technologically or medically, for them to get treated of this HIV infection, and how can they access this?
So, for people who are infected with HIV, most important is it is now a chronic manageable disease.
Yes.
If they take their medicines daily and continue to lead they can continue to lead a normal life with whatever vocations that they are doing. Most important thing is that they need to be removing that stigma that because I have HIV, I cannot do 1, 2, 3, 4, 5. They and the medicines which are available at all the centers, they need to be adherent to this treatment. They need to, if they have any addictions, how they can minimize those addictions, how to take care of their nutrition, have nutritious diet, being away from the addictions. This will help them retain their health. We have people who have been on treatment for more than 20 years and they are leading a normal life. Yes. So, because one is infected, person need not feel that it is end of life. Yes. It is not so. That is one. The second is we also have under mainstreaming and the government of India has passed HIV Prevention and Control Act, under which discrimination at any of the settings, including the education, the employment, or discrimination at any other workplaces is not permitted. Yes. So that the person can, so that there is an enabling environment for the person to lead the normal life.
Not permitted in the sense, is there a legal punishment for those who do it?
It is, the person can put in a complaint with the competent authority, and it will be seen that the discrimination that this person has faced and whoever the institute or the individuals will be, there is an ombudsman where the ombudsman can take the decisions pertaining to the extent of discrimination.
Okay. And what about the technologies that are available now? Is there any app or website where they can access any counseling?
So, any of the ART centers, we have a full team of doctor, counselor, staff nurse, where the screening for tuberculosis happens. There are also social benefit schemes to which the patients who are poor are referred to so that they can avail of these government schemes. We also have, in Mumbai, we have developed an app which is called as a Zindagi app, which has got a lot of animation videos which takes care of most of these FAQs that the patients have as to what do I do about my marriage, what do I do, would my baby be infected, who do I approach to for my addiction,
this
mental
is
health.
By AI or actual people answer these?
These are animation videos.
Animation videos, yes.
So within that animation there is a the person, so the characters who are there would have this situation and through there what did they go through, how did they counsel each other, the interaction, the person learns and learns how do I manage or cope up with this situation.
Yes. Is there any toll-free number or a call number that these people living with HIV can.
Yes, there is a toll-free number 1097.
Okay.
Which is available free of cost
Yes.
by Government of India,
Yes.
wherein they can get counseling in 6 languages.
Okay. Okay. Sure. Yes, ma'am. And is there anything else you have to talk in this video about HIV or people those people who are living with HIV?
I would say that as this is related to our sexuality, our behaviors, we need to be open. We need to be practicing responsible behaviors,
Yes.
keeping safe for not only ourselves personally, also our partners from getting this infection.
Yes, yes. With this, we'll wrap up today's session. And thank you for listening. Do share this video. It's a very important video. And Dr. Srikala Acharya has also mentioned about a toll-free number and even the app. Thank you very much, ma'am. Thank you.